KNZR.
God bless America, and welcome back, buddy. Hey, it's Monday. Woo, woo, woo. Zippity doo dah zippity a. It's Monday on the Jaz McKay Show at 1560 AM and 97.7 FM. KNZR. And we've been missing this guy now for months here on the show, and he's back with us again, Dr. Mensink. How you doing, buddy?
I'm doing good, man. It's good to be back.
It's good to see you, man. It's good to have you back on the show. We love you to death and just missed seeing you for a while. I know things have been pretty hectic over there at the practice.
Practice is going well. Yes, very well.
Yeah, I saw a new commercial of yours on TV. Today.
I haven't seen it yet.
You haven't seen it?
I've seen the original ones, but
no, there's a new one on TV, man. It's awesome. It's not as good as your radio spots that we do
of course,
here,
of course.
But they do their best.
It's interesting. People have missed it. We have had many comments.
Yeah, I love spending time with you, and our listeners love it too. By the way, if you have a question for the doc, now'd be your chance to get it in at 399-1560, 399-1560. I wanted to talk to you today, Doc, because we haven't touched on this, but because I just don't know that much about it, and I keep hearing both sides of the story. Both sides make very good, valid points for and against mandatory vaccinations.
Yeah, it's a big issue right now.
It is.
Kids coming back to school.
What's your thoughts on that?
Well, June 30, Governor Brown essentially signed SB 277, which we all know essentially made mandatory immunization and vaccination. There are several issues about it that really hasn't come out in the law. All right. Mm-hmm. First of all, it is probably one of the top three stiffest or toughest laws in the country. Mississippi and I believe Virginia, if I remember right, are two other states that have very similar laws. It was essentially driven because of some panic from things down in Disney with about 100 cases of
measles.
Yeah, but there's several issues. First of all, and I think it hasn't been, I think, represented fairly. All right. That's my first comment about it. The law, in fact, Governor Brown made it very specific that he said he would only pass a law if it made it easier, listen carefully, easier for parents to get exemptions. All right? Mm-hmm. Now, that didn't come out, okay, and that's not being publicized. Number two, and we'll go into it just a bit probably, I think it'd be worthwhile talking, there's of how you get exemptions and what those exemptions are. Number three, the law does not cover every student in this state. A lot of people are totally, it's been put out that everybody in school and has to be, this happen. And that's not really true, all right? There's several exemptions that are worthwhile. What do I feel about it, Jazz? I have a lot of kids that come to me for exemptions, all right? And here's what I tell them. I personally believe that it should be a personal issue as long as we don't have a rip-roaring epidemic going around. Number two is I believe in immunizations for most. The problem if you don't do immunizations is if you get a large enough group, all right? It takes many people. But I think somewhere around 7 to 13%. If you get a large enough group that are not immunized, it can take off very quickly. All right? Mm. And I use a comment, the idea of polio. I mean, we never see cases of people paralyzed from polio anymore. No. It was a terrible illness. And the vaccine is not a perfect vaccine by any means. And there's lots of problems from it. And all vaccines have lots of issues. I mean, you can go on the web and you can read all these horrific things. Some proven, some not. Some junk science, some good science. The jury is not out.
I think that's why a lot of folks are confused.
Yeah, sure. But the fact of the matter is, as long as enough people are immunized, the chances of getting in trouble are very small. But when more and more people are not immunized, it gets larger. All right. Now, the reasonings for it. In fact, that's one of the reasons I believe the law states that if you are homeschooled, you do not come under this law, and you don't have to be immunized.
That makes perfect sense.
All right, because the kids aren't going to be around spreading it all over. And you follow what I'm saying?
Exactly, and it sounds to me almost as if, and this is going to sound weird, as if Jerry Brown is incentivizing people to homeschool.
Well, I don't know if that's true or not, but it may have that effect. All right, but literally, the homeschool community is very aware of this. You know, they're not under this, and they don't have to get their kids immunized. There is the law has written into it a specific way of getting out of it. Okay, and getting a waiver. And here's the thing that's kind of neat about the law that really people haven't really understood. It hasn't been publicized. But first of all, if you before July 1st, 2016, so that's roughly 11 months from now. If before then, and if you want to have your kids not immunized, I strongly encourage you to do this. But the sooner the better. But if before this date you have the right to go to your doctor and get a letter or an affidavit that you give to, and you write an affidavit or a letter to your school saying that you have that your religious beliefs make that you are opposed to the immunizations. Mm-hmm. And if you do that before July 1st, 2016, essentially you will be grandfathered under the law that you will not have to. No, don't say it quite that quick. You won't have to have the immunizations apply until first grade or seventh grade. All right. So if your kid is in third grade, for instance, you've got years to go.
Oh, until seventh grade.
Now, that's the way I understand the law and saying. So that's hasn't really come out. Do you follow what I'm saying?
I hear you.
All right, so that's another way of getting around it. I don't know if that's the right word to that, but the law was Governor Brown made it very clear.
So there is a religious exemption because I kept hearing from people that
sort of, okay, and for a while, for a period of time, yeah. All right, and I look at it, that is there depending how old your kid is. I mean, if your kid is turning 7 this year, that religious exemption really doesn't mean anything, all right, because you're going to get but that religious exemption was made for the next cycle when they need their immunizations.
Okay.
And so I think there's a large amount of kids who will possibly, if their parents want to, fall under this that have options. All right. Now, my big question is, in practice, if this hasn't been really known that much, and I'm not sure that the school people know that much about it, will it be accepted? Do you follow what I'm saying?
Sure.
And it probably will end up going to some court case or something to change things. I don't know. But that's really the issue.
Well, I got to ask you this, just in general. First of all, okay, from a doctor's perspective, you're in favor of immunizing your kids.
Yes, I am. Here's the issue. I have many parents that don't want to, and I have no problem signing those waivers for them. And I have kids that, by the way, have serious reactions and shouldn't get immunized. Okay, but there is a trade-off that you have to be aware that exists. Do you follow? Number two, I personally don't think the jury is in, so far as the learning disabilities and all that kind of stuff, whether it's so or whether it's going to end up.
I don't know. I've heard that's BS. Yeah. I've heard a lot from
folks. There's both sides.
Or is that just the pharmaceutical companies getting out there and sending out some kind of
there's
messages?
I mean, you can get into some of the stuff for the pharmaceutical. I mean, there's a lot of bad blood on both sides of this. I personally don't know. I don't think the jury's in. And I think it'll probably be a few more years before that. But whether the jury's in or not, these are health decisions that are made for society's good, not for the individual's good.
Well, that was my next question. As a conservative, you can't think this is a good thing. The forcing parents to do something with their children that they don't want to do.
Yeah,
big government.
Sure. It's and we have this massive increase in different learning disabilities, things like that. Much of it's people are pointing fingers at the immunizations, and I don't know. I mean, if I had a kid that had a learning disability and I was reading all the stuff about mercury and thimerosal and all these preservatives, I'd go, oh my gosh. You follow what I'm saying? And I kind of lean towards, as long as there's not a major overwhelming problems, give the parents a choice. Now, that's my personal view. Now, what happens if we got half the town infected with measles? There's a price to pay. Or if let's say polio, where people are getting paralyzed. I think if the people realized what the other side of the downside is, and you got people all of a sudden becoming paralyzed and all these other terrible things that happened with the polio epidemics here, people would look at it and take a very different attitude.
Because the polio and the measles are two. I mean, that's apples and oranges, isn't it? I mean, measles is bad, and it's dangerous.
There's bad things that happen, but look at the years ago from our polio epidemics, which we only see, most of those people have passed on by now. But do we want to go back to that day?
Exactly. We've not eradicated the disease.
But as long as you don't have that many, if there's a very small percentage that are not immunizing, the chances are very small. But when you get into these higher percentages, that's when the risk starts to take off.
Now, once everybody's been immunized and polio has virtually vanished, how does it make a comeback?
I don't know the answer to that, Jazz.
We don't know how.
No, I don't know. It's hard. You got to remember, Jazz. Let's talk smallpox, which we do know about.
Okay.
All right, and smallpox was, quote, supposedly disappeared from the earth. But the fact of the matter is, and in fact, there we have these. I think there's 6 labs, if I remember, that hold the smallpox viruses, things like that. But the fact of the matter is, that it is impossible to get rid of every smallpox bug in the world. I mean, it's not going to happen. I personally think it's ludicrous. We really only can control it and make sure it is under control, and that's what's happened.
And make sure that no damn terrorists break into any of those labs that have the bug. Can you imagine that? We'll take a break. We'll come right back. 399-1560 if you have a question, medical question for the doc. Dr. Mensink is with us this afternoon. Talk to the doc from the practice. Dr. Jan Mensink is with us here on KNZR. You've heard Dr. Mensink on my show, and some of you called and asked me about the practice and how it works. Well, for only $69 a month, you can see Dr. Mensink anytime and with zero copays for your visits. But here's the deal. I just found out that the practice is filling up. Now, the feedback that I'm getting is that people truly enjoy the convenience of having their own personal family doctor with no long waits for an appointment. Lots of folks are supplementing their own health insurance because it's either more convenient or more affordable. Patients are finding it comforting and affordable to have a doctor for their child, too, with zero hassles and no insane waiting rooms. Now, if you need family coverage, I think you should take advantage of the family plan. The first 2 people in the home pay just $69 each, and your children are then only $20 for coverage. Now, remember, that's zero copays, hassle-free appointments, and quality care. You can't beat that. So do yourself a favor and call and sign up today before the practice fills up. 871-3300. That's 871-3300. Welcome back. Jaz McKay program with Dr. Mensink on KNZR this afternoon. Chuck is standing by. Hey, Chuck, how are you, bro?
Hi, Jaz. Doing great. And I have a question for the doctor.
Go right ahead.
Hi, Chuck.
I'm a 67-year-old guy, still kind of athletic. And I heard a couple of months ago you talking about hormones and how the new type of hormones they have nowadays are much better for you. They don't have the effects that the old style did. And I was wondering if testosterone is something I should check into and what the name of that new type of hormone is called.
Yeah, I'm a strong believer in what's called bioidentical testosterone or bioidentical hormones. In 1999, to know, so you understand the history of what happened, but for many, many years, we used different hormones. A lot of it was started by Premarin, which is actually made out of 31 different estrogens from horse urine. A lot of people don't know that, and a lot of estradiol, a lot of synthetic hormones that were done. And bottom line, a lot of women were having trouble, and we were. And in 1999, the Women's Health Initiative came out, a long, multi-year, thousands of patients, and it became abundantly evident that these things were bad for these synthetic hormones or non-natural hormones. They cause increased strokes, heart disease, cancer, clots, you name it. I mean, it's just bad. Everything is bad. And so there was a major shift in the medical community, which essentially said, no, we can't use these things. You go through menopause, tough luck, it's the way it is, and that's it. And that has stayed today. But those studies were all redone with bioidentical hormones. And bioidentical hormones, a lot of people say they're natural hormones, and that is not really true. That's really a misnomer. And in fact, most of these hormones come from yams and things like that are the raw material, and they're adjusted so they are equivalent or a bioequivalent to your regular hormones. All right? And these studies were repeated with the bioidentical hormones. And bottom line, they do exactly the opposite. They lower the risk of stroke, lower the risk of heart disease, everything is good for them. Now, the problem, here's the major problem, is that they are natural hormones. Bioidentical hormones are the same as the hormones in your body, so no drug company can make a pill out of it. You can't patent it, kind of thing. So bottom line, they have to be compounded because they have to be compounded. But they work. I'm a strong believer in it. For men, we have testosterone, all right? a lot of people think, I have patients come in all the time. In fact, I saw a guy this morning, and he was 68, and his response is, I don't have sex anymore. I don't need testosterone. All right. And what people fail to understand is testosterone. I don't give it to you so you have a good sex life. I mean, that may be a byproduct, but that's not the reason I give it to you. The hormones have major issues in, number 1, weight loss, number 2, feeling good, number 3, in immune system function, number 4, in cancer protection. In fact, we have now studies showing that bioidentical hormones literally decrease the risk of prostate cancer. All right? It's amazing things are happening. So to feel really good and functional, I'm a strong believer in bioidentical hormones. Now, a lot of another tip that patients get, we have a lot of patients come and see us for bioidentical hormones, and there's a major thing that doctors make a mistake with. Two things. Number 1 is if you have, let's say you're a male and you want to be checked your levels. Men, we can check your levels. Women, we'll get into that in just a minute. It's not quite as easy, but there's a blood test. And the two things is that many doctors or patients get their total testosterone checked, all right? And what that is, to put it real simple, is that there's a great big amount of what's called a steroid-binding globulin, but a great big globulin that holds a little miniature piece of testosterone that is inactive, all right? That steroid-binding globulin is, with that little piece of testosterone, is inactive. And then there's a little bit of free testosterone. And only that free testosterone is what's active and does good. So if you're going to, does no good to check your total testosterone level, because you're just checking all this inactive testosterone plus this little miniature free active testosterone. You need to have a free testosterone level. All right?
Okay.
And then if that's low, you want treatment. In our office, if it's less than 7 to 9, we tend to treat and be aggressive with that because it works.
Otherwise, what do you have to do? Send out for a special...
Well, for women, it's different, all right? It's because of the way women's hormones do and how their body... We don't have tests for free, many of these free,
estrogen,
estrogens, progesterones, prednisolone, and all that kind of stuff. It's not
Before
as
we
easy.
get to the ladies too far,
but
is this something that I have the doctor prescribe for me?
Yes, they can only be prescribed.
Well, I was going to ask, is this a commercial thing? When you say compound, does a pharmacist have to make that himself?
Oh, yes, okay. The bottom line is there's only 2 ways for males to get bioidentical hormones. You either have to be compounded or they have to be put in as pellets, all right? And the pellets are essentially, think of them like 4 or 5 grains of large grains of rice. We make about a 1/4-inch incision in your belly or your butt.
What?
Yeah, and we put in this honking big needle, and it was all done. It's not numbing.
For sake! And
we put in these pieces of 5 grains of rice essentially, and what happens after about 2 weeks? They start to absorb.
Sure, they're not transmitters you're putting in it.
Man, you're too paranoid. But they last for about 5 months.
How often do you have to do that?
Once every 5 months. And they work well. Women do very well with bioidentical hormones with the creams, all right, for several reasons. Their skin is different. Number 2, they're compliant to do as we tell. About half of the men don't. Our skin is thicker. Our skin has more oil in it, and it doesn't. About half the men don't absorb as well. And number 2, we asked the men to massage it in for 2 minutes, and the typical thing is for 10 seconds, and massage away they go kind of thing, and they don't get results. So if you don't have results, we strongly recommend the pellets. It's a simple procedure. It takes about 10 minutes to do in the office. We do it all the time.
You got them there? What, do you got a fridge full of these pellets?
No, actually, we essentially sign. We write a prescription. We send it out to a place in Colorado, and they ship it back the next week. And next week we do it. And it's not. In fact, the pellets are kind of. I'm a strong believer in the pellets for men. I do it myself, and these pellets, testosterone pellets, they charge in Hollywood and places in some of these fancy places in San Francisco. They'll charge $2,500 to $4,500. All right.
Whoa.
Yeah, and no, seriously. And in fact, we looked at this for quite a while. For about 9 months, we spent and negotiated with the company. And today we have a price that's less than the cost of the bioidentical hormone creams for our men. And that took about 9 months to get that price. But it's phenomenal. I think we charge the depending what level on. But if you're on a level tier 1, we charge $40 to insert them. If you're on tier 2, it's free. And the pellets are $128 for 5 months supply.
Yeah, that's not bad.
And that's not bad. So it's less than the creams. And so it works well.
That's not bad at all. Really.
Yeah.
That's not bad
But talk to your doctor. The biggest mistake we see with men is, number one, is making sure that their free testosterone levels are ordered. Number two is to make sure that that levels, a normal free testosterone level is probably about 3.4 to 38. And 38 is when you're 20, and 3.4 is when you're 80. And I have people coming in, it's 3.5, you're normal, forget it. That's really, I think, wrong. We believe in optimizing those so that you're probably about 45 or something like that, 35, 45, because you'll do so much better.
Chuck,
all right?
You got that? Now, you might want to give them a call, make an appointment, go down and check out the practice. The number is 871-3300. That's 871-3300. Chuck, have a great one. I hope everything works out for you, brother.
Thank you very much.
You take care. We'll take a break. We'll come right back. Wes is standing by with a heart issue. We'll continue next with Dr. Jan Mensink from The Practice. Give us a call. Give us a call right here on the Jaz McKay Show this afternoon, 399-1560. Right back after this. We'll get to that later here on the Jaz McKay Show, so stick around. Wes is with us this afternoon. Wes, how you doing, buddy?
I have no idea.
Well, let's find out.
Tell me what's happening, Wes, man.
Dr. Mensink, back in February, I went through a heart failure, had an enlarged heart, and my body filled up with fluid. Now my doctor's got me on a low potassium diet, but it seems like every 4 or 5 days without eating the Gatorade, the potatoes, the avocados, the peaches, I seem to get muscle cramps. And when I eat something like with potassium in it, then I feel better. Is that a good idea to be on low potassium?
Okay, several things. First of all, Wes, do you mind if I ask you some questions?
Wes?
Yes.
Do you mind if I ask you some questions?
Sure.
Do you have any problems with your kidney function, your renal function?
No.
Okay. Number two is, is your heart failure under control?
Yeah, they've got me on 6 different medications.
Sure. Okay,
my heart is fine
let's
now.
talk about, let's talk about heart failure and potassium, okay? That's probably the first thing you have to understand is that potassium is good for your heart. Number two is that if it is good for your heart, if you don't have enough, essentially you can die. And the classic example, and this is probably about 30 years ago, but I was working in the ER one night on a man that had a very low potassium level of 1.4. He was in recurrent atrial fibrillation, was dying. We shocked him about 30, 40 times. We knew this, and it's the only time in my life that I pushed IV potassium, I think 10 milliequivalents, which if I give it to you or me would kill you instantly. And this man all of a sudden stopped fibrillating, heart went to normal, and woke up, and it saved his life. And I did it. I was scared spitless when I did it, kind of thing. So, but potassium is not the problem here. Most of the time, when you need a low potassium diet, there's several issues. Number one is that when you go into congestive heart failure, your kidneys don't clear the potassium that you have in your body, all right? And so the potential for the potassium to go up can be very dangerous and can kill you. Number two, many of the medicines that you use for congestive heart failure end up being having very small windows of tolerance to potassium. And so if your potassium gets too low, or too high for that matter, that window of very serious effects can come. So to me, it's not the issue, is potassium bad for my heart? It's not. It's good for your heart. But at what level? Do you understand what I'm saying, Wes?
Yeah.
Now, the second thing that needs to be addressed if you have congestive heart failure, and many of the times these patients are on medicines that alter their potassium balance, okay, in their life.
I've got one of those that I take.
Sure. Okay. Well, here's the other thing that people don't understand with that. These medicines have other side effects that can largely affect the metabolism of minerals, and one of those is magnesium. All right. And I tell my patients, if you have low magnesium levels, you'll have major heart issues. And there's just a simple way. I mean, you can check. It's fairly easy to test for. But there's a very simple way of doing that. I tell them to eat a green leafy salad every day. And if you have normal absorption, you'll have lots of magnesium and probably lots of potassium also. The other thing that you have to watch when people have a lot of problems with congestive heart failure, and they have a lot of weakness if they don't take potassium, but the doctor tells them not to. one of the things we watch for very carefully at the practice, many of these patients are put on what's called statins, simvastatin, atorvastatin, or one of the statins to help with the cholesterol levels. That's very, very common. And what people don't understand, and a lot of doctors forget about this too, but the statins affect the coenzyme Q10 levels, and over time can lower those levels. And essentially they'll make you weak and tired, and muscles ache and all that kind of stuff. It can have a major effect and can be misinterpreted as really a potassium problem, and really your statins are giving you trouble, and you really need to have coenzyme Q10, which you can buy across the counter, by the way, and is very good for the heart. But ask your doctor about those things. Most of the people, Wes, who have your type of problems, and their doctors tell them to put them on a low potassium diet, what it really means is that you have renal insufficiency, and you have a very small window and your of risk to keep your potassium normal. And he's afraid, because you've had high potassium probably in the past, he's going to get in trouble with your medicines. And literally high potassium can kill you.
I had no idea.
All right.
I had no idea. Wes, good luck with that, brother.
When I had my first blood test, they hematized the blood, and
let's talk about
potassium
wait a minute,
level
that's
was
something else
6.4.
altogether.
Wes. Yeah, it's good you mentioned this. Okay, it's what's called Humanization. Whenever you take a potassium level, and this is very important, and there's little tip-offs that we see. But what happens is if the potassium is often in the red cells themselves, and if your red cells are fragile, or if that blood specimen gets knocked around or bumped around, essentially the blood cells hemolyze, all this potassium runs out of the cell, and it raises the potassium levels. And the first thing we do, Wes, if you come in to see me and you have a high potassium level and your kidney function is normal, the first thing we do is repeat it, all right? Because often what happens is this has been a hemolyzed specimen, and I will treat you incorrectly on this high potassium level when it's really hemolyzed. So the first thing you want to do is if you have a high potassium level, and then the doctor will check to make sure your kidney function is normal. And if it is normal, 99% of the time, it's really due to a hemolysis issue, and it has to be repeated. And the blood has to be looked at very, very carefully.
Now, that's because the blood has been jostled in the testing?
Yeah, think of it that way. Yes, that's a good way of saying it. Essentially, the blood cells have ruptured. And most of the potassium is inside the cell, intracellular potassium, which we cannot measure, except with very fancy lab tests kind of thing, research kind of stuff. We measure the serum potassium. And that's what's in the serum, which the red cells are bathed in. But if some of these red cells rupture, they what's called hemolyze. That potassium leaks into the blood, and all of a sudden the blood level goes up, and we can say, "Oh my gosh!"
Yeah.
All right.
So you think that maybe that's what's the thing here?
It's hard to know, Jazz. I mean,
how many of those blood tests how many blood tests do you do, Wes?
Well, I had to have a blood test the next day, and it came back normal.
Okay, so that's if your blood test potassium was high, they repeated it. All right, and I've had cases that their potassium levels are off the sky, but their kidney function is normal. The first thing we do is repeat it. Most of the time, 95% of the time, it's normal kind of thing, and it's just been a hemolysis issue.
So does he have anything to worry about eating bananas?
Well, we don't know if he has true hypokalemia or not. Mm-hmm. All right, I don't. That has to be done by his doctor to look at. If he does have true hyperkalemia, all right, then he should not eat bananas. 1 inch of banana is equivalent to a 10 milliequivalent of a potassium tablet.
Wow, really?
All right, 1 inch of banana. In fact, I would rather give my patients half a banana every day if they have low potassium
than to take a pill,
because it's cheaper, safer, and better for you.
Sure,
kind of thing.
Tastier too.
But this is not an easy answer to answer on the air, kind of thing. But that's kind of the issues, Wes, that would go through my mind. Any other questions?
No, that'll do it.
Okay, my friend.
Wes, good luck, buddy. You take care. So that could be a false positive as a result of somebody in the lab shaking a tray or something like that full of blood samples.
And it doesn't have to be that much shaking. I personally think, I really don't know if this is true, but my suspicion is that it's not so much how much trauma, I mean, we know trauma will do it, but how much trauma the blood receives. But I suspect it may have more to do with the fragility of the cells themselves, all right?
So that could be something else altogether for Wes.
Yes, a totally different thing.
Wow. The practice, folks, if you don't know, it's prepaid family medicine. It's different from what you normally experience with your doctor. You pay $69 per month, and you can see
the doctor as often as you want.
As often as you like. It's concierge service. It's generally reserved for rich folks.
Well, Jazz, our whole goal is, our motto is cost-effective quality care in a concierge environment. This is not like a concierge environment where there's, you pay thousands of dollars. But essentially, to make it real simple, it's for $800. You have a doctor who you can go in any time of the day.
For a whole year.
For a whole year. No long waits. 40% of our appointments are same-day appointments. No rushed appointments. The average doc in this town has 4,000 to 6,000 patients for primary care. We limit our patients to 1,100 per doctor, and you pay for that privilege. But that privilege of $800 so that you can come whenever you want, no long waits. You don't have to take the whole day off to go to see the doctor, kind of thing.
No,
all right, and many people find it. I mean, it's less than a cup of coffee a day for that privilege, and it works.
Dr. Mensink is my doctor. I would highly recommend that you make him yours. Give him a call at 871-3300. 871-3300, 871-3300. Set up a time, go in, meet with Dr. Mensink and his staff, and they'll walk you through the clinic. And
by the way, we have a free meet and greet thing where essentially you come by the office, we'll spend 5-10 minutes, sit down and talk to you and share with you what it was. We're not going to treat you for any medical issues, but we'll just share you how it works, show you the office, because most people think there's a gimmick to it.
Yeah.
Literally, most people think there's a gimmick. And we tend to be very frank and open. We'll show you what we do and all that kind of stuff, and we'll show you the different levels and what's included.
It's not the ShamWow of medicine. But, it's not the ShamWow of medicine, folks.
But go to the website. That's probably the best thing to do.
Yeah.
Go to the website.
As soon as you get that picture changed. So. Appreciate you being with us. It's always good to see you, Doc.
All right.
Love you to death. God bless America, my brother.